Catherine Fiancan from France 24. Catherine?
Yes, do you hear me? Hello? Do you hear me?
Yes.
Okay, good afternoon. Thank you for taking my question. I would like to come back on the lifting of the lockdowns because, as you know, on May 11, the countries that have been the most hit by the coronavirus in Europe and in United States are allowing kids to go back to school and some people to open the restaurants back. So I would like to see with you to remain us what you know about the children, because in order to for parents not to be nervous, people say that children cannot be affected, that they cannot transmit the COVID. So could you please tell us what is exactly the knowledge, what you know about the virus for the moment, and also how long does the virus stay alive on a surface? Do you have an idea? Do you have a precise idea for the moment? Thank you so much to you.
So thank you for the question. This is an important question. As you know, we are learning more about this virus every day, and we are all concerned about the impact of this virus on children. What we know from data from all countries that we are receiving data from is that children appear to be less affected, and developing disease. And that means when you look at the number of cases that are reported from all countries, a very small proportion of those are children, ranging between 1% and upwards of 5% are among children up to the age of 18, in some countries 19. So it's a small proportion of the total number of cases detected. Among those children who are identified as having COVID-19, the vast majority of them develop mild disease and recover. And that is very important. We are trying to understand why that is, and there are studies that are underway to better help us understand that. There are some children, some who have had underlying conditions, others who have not, who have developed severe disease, who have had critical disease, and some children have died. So we cannot say universally that it's a mild disease in children. But the vast majority of children who have been identified as having COVID-19 have mild disease. You heard of a report the other day of an inflammatory disease in some children that was identified in the UK. Now that is significant in the sense that we have astute clinicians and nurses and healthcare professionals who are looking at how this infection is impacting the body, and they picked up a signal. This may be a real signal having to do with COVID-19, or it actually may not have to do with COVID-19 at all. What we've done within our clinical network, which is our global clinical network, is raise the alert and say, please look out for this. And we thank our colleagues in the UK for raising this so that we can better understand if this is something that is actually related to COVID-19. So just to summarize on the disease, the overwhelming majority of children who are detected have mild disease, and that's important. With regards to transmission, children are susceptible to infection, which means that they can get infected. And from the studies that have been conducted, which are well-designed studies in households, for example, they've looked at if adults are transmitting to children or if children are transmitting to adults. And in most of those studies, it's adults transmitting to children. But there have been some instances where they're suspected that the children infected the adults. So it can go both ways. Again, we need more information to better understand this. But children do remain susceptible, and they can get infected with this virus, but they do tend to have mild disease.